Guys, this is going to be a little dim and short. It's Jamie here, and it's Saturday evening, 8 p.m. I just finally got up enough to be able to do this, and I just feel like it's important to show good and bad. So last night I started having a lot of head pain from the brain tumor, and took some medication and went to bed. And as luck would have it, years ago I had a bad case of pancreatitis and ended up with kidney failure for a period of time, and now my right kidney is very sluggish and tends to form stones and get infections a lot, and I have one now. So I had a pulsating kidney, my head was pounding. Finally got to sleep. I woke up at about 2 a.m., drenched in sweat, nauseated, ready to vomit. I had to take off running for the bathroom, medicating myself. Since I've been up today, it's just been staying here in the bedroom and trying to hydrate and taking meds. Did a little bit earlier. It was just mainly the pancreas for a few hours. And now the head is just jackhammering. And I'm doing this video because I have a public service message, and it's about the pain scale. If someone says, the pain scale is a 0 to 10, 0 is no pain, 10 is the worst pain you could ever imagine. And if somebody would look at me right now and said, what's your pain scale? I would say about a 6. And it's hurting pretty freaking bad. But if I'm able to pick up a cell phone and talk to you and have light shining on me, I'm not a freaking 10. And people that do that and say, I'm a 10, I'm sorry. No. I've been a 10. And at 10, I was curled up in a ball, screaming, begging for pain meds, peed my pants, threw up on myself, and passed out, basically. And then, I'll never forget it, screaming like that. It was with pancreatitis, with an acute post-procedure. Ended up 3-month hospitalization. That was the kidney failure and everything. So, this is not a 10. This hurts like but it is not a 10. If you could text, you're not a 10. If you can video, you're not a 10. And when you go to the ER and say you're a 10, then they think you just want drugs. And so this is my public service announcement. Don't be going to the ER and saying I'm a 10 if you're on your cell phone, if you're videotaping yourself, if you're texting people, if you're calling people. Because then when you say I'm a 10, you're going to get labeled as a drug seeker. And they label chronic pain patients as drug seekers, and we don't need to hurt our own reputations. Keep your pain scales true to form. I'm a good 6, probably moving up to 7, and that's painful as shit. It's not a little bit of pain, folks. So don't be ashamed to say it. Don't think if you give a higher number, you're going to get more drugs. You're probably going to get less because they're looking at you going, there's no way if you're on that you're hurting that bad. So do yourself a favor. Stop over-exaggerating pain scales in an effort to get more pain meds, because you really need pain meds. Be realistic about what's going on, and work with your doctors and nurses. And I'm just saying that because it irritates me when I go to the ER and get treated like crap, like a pain seeker, when I'm really hurting. And I don't go to the ER when I'm like this. When I go to the ER, I really am curled up crying. And I'm not a 10. I might be like an 8 or a 9, like really hurting. but I'm not faking it. And I'm not be videotaping myself. I might, after they give me drugs and the pain comes down and I'm feeling better, but no. So if I seem grouchy, this is why. Just do yourself a favor and just, be a good patient and don't ever over exaggerate things. Just know that those of us who are really hurting don't want to get treated like pain seekers because of people who just go and we've all seen them. The people that are chatting and bouncing around the room and claiming they're a 10 and they're on their phone and they're snapping selfies and shit like that. And you hurt legitimate pain patients when you do that. Legitimate pain patients at 10 is not behaving that way. Ever. And the people that fake it to try to make it to the opioids, whatever, they hurt chronic pain patients. And it makes me angry because it's not fair. But anyway, this is short and sweet because, maybe not sweet, but I'm done. I'm turning off the light and I'm taking my pain med and my nausea med. And I'm hooking up my IV fluid. And I'm going to bed. Because my head's done. My head is done. It's done. It's done. I can't even. I'm done. Almost to 7 now. I'm done. So God bless everybody and have a good night. And let's fight for equal and fair treatment for pain patients. Legitimate pain patients who deserve to be treated when they're uncomfortable. Good night, everybody.